This special show of DentisTv from the BDTA Dental Showcase is brought to you by Denplan, at the heart of dental care. Coming up in this show, we have a thought leader interview with Dr. Tony Kilcoyne about the title of dentist and the GDC ruling. We have 60 seconds of social media, best of the best, and a product review from the exhibition floor. So pull up a chair, make yourself a cup of tea, and enjoy the show. I want to talk to you about what we call at DentisTv a stand magnet. And this is something that you have at your exhibition stand that attracts big crowds and lots of people. So we've got some great examples of people who did just that from the BDTA. Some of these that's really stood out to us was the stand of Shulka and Maya. Every hour on the hour they have dancers who dance to Can't Touch This, and it promotes their hands-free, touch-free decontamination dispenser for their alcohol solution. And not only do they have dancing, they have a little mascot who walks around the whole exhibition hall and attracts people to their stand. And you'll see I had my picture taken with him earlier today. Then another stand that's really attractive and has an interesting feature is DHB. They have a moving floor that's lit up in a very unique way. And you can get a little bit dizzy if you stand too close to it. But it's just another great way to do something different, to light up and attract people. Then, which is something that probably went down very well with the ladies at the show, was an initiative by Dental Gateway. And they're a recruitment company, and they have got a male model who is just dressed in pants, and you can have your picture taken with him. And it's just a great way to get people's email addresses to sign up so they can send you the photo with this guy. Brilliant idea. In this special showcase edition of DentisTv, I interviewed Dr. Tony Kilcoyne for a thought leader interview, and he told us a bit about the new GDC inquiry into whether dentists should have the title of doctor. It's a really contentious issue, so let's hear what Tony has to say about that.
Hi, I'm Marita and I'm at the BDTA Dental Showcase, and I'm speaking with Dr. Tony Kilcoyne. Tony, can you tell me a little bit about the GDC's recent consultation about ethical selling and also the whole issue around titles and the use of the word doctor for dentists?
Well, that's been one of, I think, the most exciting consultations the GDC's run for a long time. As you know, consultations run for 3 months. It just closed at the beginning of October, and they've had a record number of responses, well over 1,000 individual responses and organisations to that consultation. In fact, the GDC is so inundated with those responses that it's taken them an extra long time to collate them. But the news is your responses were made, they are being listened to, they are being collated, and at the final GDC meeting in December of 2010, the GDC will then announce exactly what it's going to do about the use of the title doctor by dental surgeons, and also other aspects of ethical advertising, the descriptions and links that are required on websites, and so on and so forth.
Okay. Now, what is your personal opinion about it? Would you like to be called by your patients Mr. Kilcoyne or Dr. Kilcoyne? What do you think?
Well, it's interesting, isn't it? Because everyone's got a very strong opinion about this. You're either very pro or very anti. My personal opinion is I'm very pro for this. I use the title myself, not to ingratiate myself in any way, but I come to conferences like the BDTA here. I go to conferences abroad. All the doctors everywhere else in Europe know that that's the title that dentists use too. It doesn't confuse the public. It's really a sign of respect that you've done an equivalent 5 years at university. You look after the whole patient, not just the teeth. And that is the normal title, even in Southern Ireland, in the rest of Europe and the rest of the world. And certainly we've already had the title for 15 15 years already in the UK. So it's not new, it is established, and I don't think it's as big a problem as some people make out. However, one has to respect that one must be very clear when you say Dr. Tony Kilcoyne or anybody else, you qualify it with your GDC title, such as in my case specialist in prothodontics or dental surgeon or dentist, because most dentists actually do not want people coming to them with their bunions on their big toes and all the rest. But when we take a full medical history and look after the whole patient, we want the patient to feel confident that we're both qualified and professionally putting them first as patients. So I think overall the title is positive for dentistry and positive for the public too.
Thanks very much, Tony. Well, we hope to hear back from the GDC about what they decide about this at the end. But I'm Marita Kritzinger, back to the studio.
Before we continue with the show, I'd just like to take a moment to mention this special Showcase Edition sponsor, Denplan, at the heart of dental care. Now, Denplan is the only dental payment plan provider that patients ask for by name. Denplan prides itself on working for the benefit of you, your patients, and your practice. Some of the services that Denplan offer you if you become a member is online support services designed to ease practice administration, marketing and business support, from bespoke marketing materials to financial planning, tailor-made clinical and practice management training with verifiable CPD for you and your whole team, seminars to keep you informed about regulatory and political changes, practical support with HTML 105 and CQC registration, bespoke practice training to help with business development, and also networking opportunities with like-minded professionals. And now for some product reviews from dental professionals from the exhibition floor.
Hi, I'm Simon Thackeray, Principal of Thackeray Dentalcare in Mansfield at the BDTA 2010. In the market for two new surgeries, particularly dental chairs and cabinetry. I've seen some things that really do make me think, particularly nice Porsche design dental chair. Not quite sure whether that would fit in with what I'm looking at trying to do. The choice I think for me at the moment is going to be between the ADEC units and the Belmont knee brake units. Very, very nice micromotors on the NSK stand, very small, very compact, and seem to do an awful lot of things that would integrate a lot of extra things that I've got kicking around in the surgery at the moment. So it'd be a one solution answer. So I might well have to invest in something like that. And I'm just taking in the atmosphere and everything that people are saying and doing. The political side of dentistry is moving on. There's some politicians been there today, and they're asking some quite searching questions about where the future of dentistry might be. So it's quite interesting listening to that as well. Thanks for listening today. I'm off to go and try and find the rest of my team who have got my credit card and are spending things without my knowledge. And I think I ought to try and trump them on that and buy the biggest item of the day on behalf of Thackeray Dentalcare. So thanks for listening.
Hi, I'm Zaki Kanaan. I'm here at the Dicus Dental stand at the showcase, and I'm reviewing a new product called Endo Vac 2. It's a first on the market, and it's a great product. I work at K2 Dental with my wife Dominique, practice in Fulham Palace Road. The reason why I've chosen this product because it's actually quite unique, even out of all the products that you can see at the showcase, and there's loads of products here. This is actually a first in the world. It was developed by a dentist, an endodontist actually in America, who just was thinking of ways to actually clean the actual inside of the root canal, which, as we know, is like a maze. If you can focus on this over here, the conventional way that we clean root canals is by squirting some solution down the root canal, and as we know, as the tooth gets restricted here, there's always a plug of debris, material, whatever you want to call it, right at the last millimeter at the apex. So what we tend to do with cleaning root canals is to squeeze in by positive pressure hypochlorite solution or whatever we want to use to clean the canal with, and we squeeze it down the root canals. And in a lot of the cases, that can actually extrude through. If you press too much, it will actually push through. You cause a big bruise, and it's quite sort of detrimental to the patient. And if you don't do that, it actually doesn't clean the last millimeter of the roof, and sometimes you get failures. The good thing with this system, it's by negative pressure, so there's actually material that's squirted down, liquid that's squirted down, and actually the canal is so fine it sucks the debris up, and it gets rid of the air bubble at the end of the thing. So if you want to have a look at this photo, okay? So what you can see is, in the usual way, we do positive pressure irrigation, where you put a needle down with a hole at the tip, and you squeeze the material out, and it just goes up the sides. Now, if there's an air bubble, which you can't pop in that confined space, or if there's debris at the bottom, you can't get rid of it by conventional means. With this system, it's negative pressure. There's no risk at all of actually extruding any hypochlorite past the apex of the tooth. And you actually you squirt some hypochlorite solution down the canal, and at the same time you put this fine irrigation needle in, and it actually sucks up. There's 12 holes, 12 laser etched holes at the bottom, and it sucks up the hypochlorite as well as the debris and everything at the apex. So there's no risks at all, and it's done by negative pressure. And really, it's called Endo Vac, sold by Dicus Dental, and it's actually a first in the world. So it's just coming onto the market, and I think endodontists are really going to embrace this new technology, and I think it's going to be the way forward to go.
And now for 60 seconds of social media with James Erickson from EMC Marketing.
Hey, this is James Erickson. This is 60 seconds on social media. Let's go ahead and get started. When you're using social media or Twitter or anything, there's been a lot of focus from some gurus on getting the most Twitter followers or the most Facebook friends or the most blog subscribers. Now, in my mind, marketing should have one of two goals. It should either bring new money into the practice via new patients, or up your retention figures and keep old money in the practice by retaining and keeping the patients you already have. Having more Twitter followers or Facebook friends isn't going to do you any good. You can't really load up a wheelbarrow full of Twitter followers and take them to the bank. And trust me, nobody's going to accept a Facebook friend in exchange for a phone bill or to pay off an old debt. So you need to work on converting those people to really make a difference and become tangible numbers in your practice. If you're not upping your retention figures or bringing in more sales to your practice, what are you really accomplishing? And I would say that you're really probably wasting your time. So make sure that you're converting, or you're adding new things to your practice, or you're retaining old patients in your practice with your social media efforts. Otherwise, you're flushing time down the toilet. This is James Erickson. That was 60 seconds in social media. We'll see you next time.
And that brings us to the end of this two-part Showcase Special Edition, which is brought to you by Denplan, at the heart of dental care. I hope you enjoyed watching, and be sure to tune into DentisTv for the next show. I'm Marita, and this is the show that helps dental professionals like you to go from ordinary to extraordinary.